What can you tell about my father?
After the examination, we can conclude that your father has multiple organ dysfunction syndrome, which involves several systems in his body, which are respiratory, cardiovascular, central nervous system, liver, and also kidney dysfunction. All of this system is due to abdominal aneurysm rupture and also untreated hypovolemic shock due to bleeding or hemorrhage, which causing systemic inflammatory syndrome or SIRS and lead to multiple organ dysfunction syndrome.
So what is your plan in treating my father?
Okay, it is necessary for your father to have surgery, and it is considered as a life-saving situation.
Okay, how will doctor do the surgery?
We will going to do laparotomy, which is a surgical incision that have to be made into the abdominal cavity to stop the cause of the bleeding, and also after that we will close the incision and stitch the sides.
Okay, is my father will be in anesthesia or he will be in conscious?
Yes, of course, we will administer anesthesia. For this case, we will use general anesthesia as its function is to immobilize all parts of your father's body during the surgery to prevent any complication. We will use combined anesthesia by giving endotracheal intubation and mechanical ventilation to support the breathing mechanism for your father.
What about the risk of the surgery?
As your father have bleeding rupture inside the abdominal cavity, we could say that the risk of the surgery is high. Together with high risk of thromboembolic system, there will be also a high bleeding complication that might happen.
Sorry doctor, what is thromboembolic system?
So your father have abdominal aortic aneurysm and it is ruptured. When ruptured happen, there will be a massive internal bleeding. So to treat the rupture site, which is the vascular wall, the platelet will accumulate at the site and begin to form a clot. And the formation of the blood clot that break off, called as emboli, and cause damage if they lodge into brain, heart, or other organs, resulting in reduced blood flow to the organ.
What is the chance for my father to survive or have a successful surgery?
In this state, it is most likely to have 10 to 20% chances to success with surgery and 0% chances to success without surgery.
Will there be contraindication?
If we are sure that the patient has no allergy to the medications, then the treatment will be going well. Is there anything that makes you unclear?
No, doctor.
Okay, so here is the form of informed consent where you as a relative agree to give permission in full knowledge of a possible consequences, care and treatment for your father, and also give permission to insert any special equipments such as endotracheal tube, catheter, and also other needed equipments to your father. So here's a pen, you can sign right here.
Okay.
Okay, thank you. Okay, right now we are going to do pre-operative examination for your father.
Okay.
Before begin, make sure to wash hands, wear mask and gloves. Remove all the valuable items from the patient's body. Check the site of surgery. It have to be shaved, clean, and marked before surgery. Check the vital signs of the patient before entering the surgery room. The patient changed his clothes to clean patient gown and medical cap. Insert the Foley catheter for monitor the urine output. Nasogastric tube also being inserted to the patient, together with central venous catheter that being administered at the internal jugular vein.
Okay, so So here is the checklist of the pre-operative examination that we did to your father. I'm going to confirm certain things with you. Is that okay?
Yes.
So your father's name is James. Is that true?
Yes.
His height is 170 centimeter.
Yes.
His weight is 70 kg.
Yes.
So you have signed the informed consent in special permits. Is that true?
Yes.
Okay, let me show you. Is this your signature?
Yes.
Here also present his history and physical together with laboratory record present. So from what we have obtained is his complete blood count, his hemoglobin level, urinalysis for the hematocrit level. He have low red blood cell level together with hematocrit and also hemoglobin level.
Okay.
Your father has no dentures, right?
No.
He have natural teeth.
Yes.
Did he wear any contact lens?
No.
During examination, we have removed rings, so your father wears rings.
Yes.
Okay, no earrings,
No.
neck chains also we found it and also have been removed. So your father wear neck chains, right?
Yes.
Any body piercings?
No.
As far as I understood during examination, your father has no makeup and no nail polish.
No.
We also provide your father with a clean patient gown before he entered the surgery together with cap.
Okay.
Okay, and also during the surgery, you can wait in the waiting room or you can go home and we will call you for any update.
Okay.
These are all your father's valuables. They all are secured in this plastic bag, so you can take it and keep it with you.
Okay.
During the surgery, the blood has been ordered. Okay, during the surgery, your father will need the blood, and we have already ordered the suitable blood that will be given to your father, together with fresh frozen plasma.
Okay.
Before the surgery, we will give the pre-anesthetic medication. This is to decrease the anxiety level. Also, we have inserted Foley catheter to measure his urine output.
Okay.
After the examination, we have collected vital signs, which are his temperature is normal, 36.3 degrees Celsius. His pulse is high at 120. His respiration is also high at 30 per minute, and also his blood pressure is low at 80 to 50. This vital sign indicates that he has a shock symptoms.
Okay.
And the area of the skin for the surgery has been marked and also shaved.
Okay.
As far as I understood that your father has no meal for 2 days ago, right?
Yes.
So he has an empty stomach, and we will insert the nasogastric tube to provide food for him to get enough nutrition.
Okay.
And then he does not need any cleansing enema because he has no stool. He does not need cleansing enema. Your father's stomach is empty, so there will be no stool and we don't need to do cleansing enema.
Okay.
For the intravenous access, where we will insert needed medications and also fluids, we will do at the internal jugular vein using the central venous catheter.
Okay.
Do you have any question?
No.
Okay. Thank you for your cooperation. Anything about your father during the surgery, we will inform you.
Okay. Thank you, doctor.
To achieve stabilization of the patient before entering the surgery room, the patient has been administered normal saline solution for 3 liters together with the RBC and FFP. This is to replenish the fluid loss and also the hemorrhage in this patient. It is also to give the support in his hemostatic system. During the surgery, we continue to administer normal saline and dextrose 5% water at 500 ml to give enough fluid for the patient in the surgery room. We also administer latent Rincher solution, RBC, FFP and platelet to supply the water and electrolyte together with the low blood volume that the patient might lose during the surgery. The vital signs of the patient has been recorded before and during the surgery in this chart. We can see that the pulse of the patient begin to decrease, respiration rate also begin to decrease. The blood pressure of the patient is increased. The consciousness of the patient is decreased from 13 to 6 as the patient is unconscious when in surgery room. The temperature of the patient is normal while the skin is changing from dry to moist, showing that the fluid therapy works to the patient. The patient also having urine output about 100 ml for 3 hours before the surgery. This shows that the patient have adequate amount of fluid needed for the body to be prepared in a surgery room. The first drug is ketamine. It has hypnotic, analgesics, and amnesic effect. The second drug is propofol. It provides sedation to patient, lowers blood pressure and suppresses breathing, so the heart function and breathing of patients need to be constantly monitored, and also it is fast acting. The third is fentanyl. It is short-acting opioid analgesic agent. It rapidly crosses the blood-brain barrier and thus has a rapid onset on analgesia. The fourth is droperidol. It decreases the anxiety that accompanies psychosis, a sedative, tranquilizer, and anti-nausea medicine. It is also used to reduce nausea and vomiting caused by surgery or other medical procedures. The fifth is vecuronium. It is a neuromuscular blockade agent. It blocking the signals between nerve and muscles and given before general anesthesia in preparing for surgery. It helps to keep body still during surgery and also relax the throat so a breathing tube can be more easily inserted before the surgery. The last one is sevoflurane. It is most recently introduced agents, more rapid recovery function. Work by temporarily reducing the activity of the body's central nervous system. It causes a complete loss of sensation in the body, including the loss of consciousness, allowing surgery to be carried out without pain or distress.
For this case, we use combo anesthesia, which are inhalation and intravenous anesthesia. This is the anesthetic machine. The basic principle of the anesthetic machine is to mix gases and deliver its necessary volume into the lungs of the patient. Before deliver the anesthesia to the patient, anesthesiologist will checking everything whether it is right or not. Anesthetic machine will act as a mechanical ventilation of the patient, prepare the needed concentration of oxygen and gases, and is able to maintain patient ventilation on its own as it is set by the desire of the anesthesiologist. Anesthesiologist will check everything is full working and function before doing anesthesiology. Monitoring the patient can be done either by hands or machine, but nowadays, of course, we will rely on the technology from the machine. Here is the patient in the operation room. This patient have 10 nasogastric tube and the central venous line. The patient is getting central venous line at the internal jugular vein so that can be administered infusion therapy and also anesthetic agents itself. The urinary catheter is also being administered to the patient before the surgery to help track urine output during surgery. This is the equipment that is needed by the anesthesiological team. The anesthesiological team will be needed this equipment to do their endotracheal intubation in the patient. After the anesthesiology agent, which are mentioned before, had been administered, we can confirm the patient is under anesthesia when the corneal reflex is lost. When touching the eyelashes, the eyes do not blink. When we open the eyes, we can see the eyes stay in one direction and do not move. And we notice that the size of pupil is dilated or constricted. That is how we know that the patient is under anesthesia so that we can proceed to the next step. After that, doctor will proceed with endotracheal intubation. The endotracheal tube has a special inflatable cup. The inflatable cup will be in the distal part of the endotracheal. We can see that the size of the tube does not match the size of the trachea. Trachea is much bigger, and without this inflatable cup, the air will escape back and we will not inflate the chest. So we actually have to fill in all space in the trachea, making sure that the air goes in and out exactly the volume. It is not like the Foley catheter where the balloon serves to keep the tube inside. This is just to occupy the space to prevent leakage of gases of air around the tube. The anesthesia inhalation is given by using sevoflurane as the agent, and the patient will be anesthetized. After the patient is under anesthesia, we will perform the endotracheal intubation. The head position of the patient at this time is chin lift maneuver, which is used to open airway, and then the insertion tube has been done. It went to oval cord. It must be done very fast. Less than 1 minute is needed to this manipulation. Once the tube is inside, we attach the machine and inflate the cuff. and after that doctor is checking lung. If it is ventilated well, meaning that the tube is in the right position. Both the lungs must be ventilated to make sure that the tube is in the right position. Further goes anesthesia. Anesthesiologist team does the anesthesia, monitor the level of consciousness, administer necessary medication to keep the patient in anesthetic state. The surgeon will do their job. They perform prepping, draping, and do surgical operation which may last 3 to 5 hours, and during this time, the patient must be well anesthetized. During the surgery, anesthesiologists must add anesthetic agents like ketamine if the patient starts to regain their consciousness. This is to ensure that the patient is free from any feeling of pain. Here we can see anesthesia is over. The patient's eyes are now open and the doctor actually disconnects endotracheal tube from the mechanical ventilation. And we must make sure that the patient is able to breathe, because we administer to the patient meconium, which is the neuromuscular blocker. So we must make sure this agent must stop its effect and the patient is able to breathe. If we see the patient can breathe by her own, only after that we can take out the tube. We can see that she deflate the balloon, open the catheter, clean the saliva from the mouth which collected inside so that do not block the airway and causing choking. And the patient cough out the secretion which was present. The patient is still coughing because the tube which is the foreign material is still there and she just cleaned the airway.